On.
Good morning, I'm Dr. Ara Deuk, founder and CEO of Duke Spine Institute, and I'm here with one of my patients about a week out of surgery. What kind of surgery did you have, sir?
I had the laser surgery for the lower back.
Okay. How many discs did we fix?
Just one.
And what kind of problems were you having before the surgery?
Before the surgery, so I had a large herniation that was basically crushing my sciatic nerve from my leg. So it made walking, standing, even sleeping impossible.
Okay. So your life sucked?
Yeah,
pretty
I
much?
just pretty much went to work, went home. That's all I could do. I couldn't go out with the family or anything.
And how'd that make you feel as a person, not being able to do anything with your family?
It was frustrating because I'm only 34 and I felt like an 85-year-old person, or just felt disabled.
Yeah.
So.
Yeah, and you were. So how do you feel like when people say, well, that's too young to have surgery? What would you say to those people?
I would say look at all your options. I evaluated the quality of life I was having, and I just felt like I needed to make that decision for me and my family because I didn't want to live like that for the rest of my life. So,
well, I'm kind of getting at the idea that the people who say it's too young, they're not in pain.
yes.
They don't know what it's like.
Oh yeah, they always say like, oh, I have a little bit of back pain every now and then.
Right.
You can get through it. They don't realize the being in pain constantly all day long.
Right, and what's their solution, right? Okay,
Yeah.
you're too young for surgery, but what else is there?
Yeah.
You've tried it,
Yeah.
nothing else works. So
Right.
what are you supposed to do? Just live in pain till you're 60 for another 30 years and then have
Or take
surgery?
a bunch of drugs. Yeah.
Yeah, so there really is no other option. I mean, that's why you had surgery.
Yes.
It's not because you felt like having surgery. It's because there wasn't anything else that was going to fix your problem. So what do you say to those people who say you're too young for surgery?
Just that you never know what people are going through, and that surgery was able to fix my pain and it got me way past where I could have been years down the road, even trying other treatments. So.
Yeah, I mean, I've dedicated my entire practice to helping people in pain because I believe pain truly destroys their lives and the lives of people around them that depend on them, that love them and care for them, because they're always worried about them all the time because they're in pain. So
Yeah.
I think we need to take pain seriously and fix it when we can. What do you think?
I agree.
All right. So you're getting around okay?
Yeah.
And you're in therapy?
Yes, I'm in physical therapy just for the stretching out the muscles and stuff that got tight because of the injury. But pretty much I'm pain free. I'm able to
Good.
walk. I'm going on 20-minute walks multiple times a day to kind of get more active again, and I'm able to do stuff with my family, able to go to the store, stuff like that.
Just can you wait till everything's healed up and,
Yes.
and you can do whatever you
I'm
want?
not lifting anything or anything.
All right.
I'm following the instructions.
Well, it's great to see a smile on your face again.
Yes, thank you.
Congratulations and good luck.
Thank you.
All right.